MICAILA. I'm the head camp counselor for the first ever pharmacy camp. Our camp got started on Sunday, and on Monday our campers were in the lab compounding real pharmacy products that real pharmacists use every day for real patients. So they made a capsule, they made topical creams, they made a gel, and they had a lot of fun with that. It was really great. Yesterday they did a vital signs lab. They were able to get their stethoscopes and blood pressure cuffs that we purchased for them with the generous donations that we received on Tiger Giving Day, and they were super excited about that. So they got to learn how to do vital signs, take blood pressures, and it was really great. And then today we have them in the lab doing sterile compounding, which means they're making IV bags. This afternoon we'll be taking them to EAMC so that they can see the IV room there and learn about how pharmacists work in the hospital.
Hey, I'm Charles WOOSLEY, Director of Recruitment for the School of Pharmacy here at Auburn University. It's been our pleasure this week to have our first annual pharmacy camp. The purpose of the camp has been threefold. One was to introduce students to pharmacy as a career. Two, to introduce them to Auburn University as a potential school. And then thirdly, to show them our School of Pharmacy and how they might consider Harrison School of Pharmacy for their choice in the future. We chose to do this through multiple different ways, and one of the neat things that we started the week off was these definitions that are behind me of what is a pharmacist, what is the role of a pharmacist, what do we really do. And what's been fascinating is each day they've had the opportunity, as they've learned more about what we pharmacists do, is that they've edited, they've changed, they've added different words to what pharmacists do as they have learned through the week. I think secondly, we've been able to show students about the admission requirements, not only to the university, but also to the pharmacy school and what they must do in order to be considered for that. We chose an approach to pharmacy camp to be more interactive and involving with team-based learning. Because that's what we do in pharmacy school. In addition, we looked at a lot of different lab activities that are skills-based, and we had them exposed to things like learning blood pressures, to compounding, to seeing patient interviews. We also incorporated multiple site visits, both from a retail sense, from a community sense, in a hospital, as well as some specific specialty clinical pharmacy practices. Our goal this week was to expose them to pharmacy as a career and the many activities they could do with that profession, as well as look at our school and look at our university as a potential place they might like to spend the next 3 to 7 years.
Hi, my name's Avery. I'm from Geneva, Alabama, and when I attend Auburn, I will be majoring in pre-pharmacy. Before coming to pharmacy camp, I think me, along with the other 20 kids in my camp, thought it was more like standing behind a desk and giving pills to people all day. But after coming to this camp for a week, what we thought was about like this is like this whole world of stuff. There's different types of pharmacy, from oncology to pediatric to NICU to ambulatory. There's a whole variety and world of things that you can do.
Hello, my name is Matthew DILL, and I live in Jasper, Alabama. I will be attending Auburn University in the fall. Before I came to pharmacy school, I only really knew about two types of pharmacy: hospital pharmacy and retail pharmacy. But after this week-long experience, I discovered that the courses you can take with pharmacy are infinite. You can be behind the scenes in the hospital. You can be outside the store at Walgreens. I even found the branch of pharmacy I would like to pursue, which is informatics, which is computer-based pharmacy.